Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your college of entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is erythema nodosum. So what is erythema nodosum? This is an idiopathic disorder which can be secondary to immune complex deposition due to various conditions. It's possible to see septal paniculitis on histology. Erythema nodosum affects approximately 3 to 6 times more females than males, and its peak incidence is in people aged 20s to 30s. This can, of course, vary depending on if a secondary cause is the culprit. Erythema nodosum comprises multiple tender erythematous deep nodules, usually affecting the anterior shin. They fade generally after about a month, leaving bruising behind. There are multiple secondary causes. These include infections such as Streptococcus, Mycobacteria, EBV, Chlamydia, and Yersinia. They also include malignancies such as lymphoma. Drugs include the combined oral contraceptive pill and sulfonamides. And autoimmune disorders causing erythema nodosum include sarcoidosis, inflammatory bowel disease, and Behçet's syndrome. Here we have an image of erythema nodosum, and as you can see, we have these classic nodular appearances which look like bruises on the anterior surface of the shins. When assessing someone with erythema nodosum, it's important to take a thorough history and perform a full clinical exam. A systemic examination is particularly important to identify potential secondary causes, and relevant tests should be arranged as appropriate. So, for example, if you are suspecting an infection, it's important to test for that infection, or if you're suspecting an autoimmune disease, it's important to run that particular test, etc. A biopsy can be done to confirm the diagnosis. Treatment includes elevating the legs and removing and treating the precipitating factor or secondary cause. NSAIDs can be used for the pain, and oral steroids can also be used to try and settle this once, of course, infection has been excluded. Most cases do resolve over the course of 2 months. Okay, so now let's try a question. A 30-year-old lady presents with painful nodular lesions over her shins, which have appeared over the course of the last week. On examination, she is also noted to have swollen ankles. A chest X-ray shows hilar lymphadenopathy. She takes no regular medications. What is the likely cause leading to her skin lesions? So our options are use of the combined oral contraceptive pill, inflammatory bowel disease, streptococcal infection, sarcoidosis, or lymphoma. Now, you should first of all recognise from the vignette that the lady has presented with erythema nodosum. And all of these options really could potentially be causes of erythema nodosum. But we have to look at what the vignette is saying regarding her clinical presentation and the other information given, such as the fact she's not on any other drugs, so we can immediately exclude option A. The vignette is describing someone with classic features of sarcoidosis, and this includes having the hilar lymphadenopathy and the swollen ankles, as well as her age. And so the correct answer here is sarcoidosis. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.